I think what has really made this program stand out is the people, which you'll hear a million times. But I think it's everyone from the front desk staff at our clinic office who we know by first name, who ask me if I'm okay on a day when I'm really quiet and they've noticed a change. And then everyone up through the program leadership.
It's been, a great experience for me, particularly in my experience just as a, Black man in medicine. And it feels so important to me to, treat these communities that have been, experiencing such long histories of racial discrimination, enduring complex and difficult social determinants of health, social needs, and, helping patients get through those and also understanding their experience and, advocating for them. It's been so great to develop these relationships with the patients and let them know, I'm here to listen to you and understand your story, and, we're gonna work together to, make your life better. Some of the, greatest conversations I've had, so far, particularly around discussing, hesitancy with the COVID-19 vaccines and, addressing some of the, real distrust within the medical system, but also, trying to be a conduit of trust through the medical system. And it's been a great learning experience so far. And the preceptors and people that I've worked with as well, it's been, such a great experience.
Just to give you an overview, the core rotations here is very unique in the country in that we are provided with a lot of opportunities. For example, last year, I was doing a women's health rotation, and next year I'll be doing adolescent medicine. We also do like addiction medicine, and currently I'm doing HIV and hepatitis C.
Jumping to what do I love about the EBMC clinic? Well, I am a Spanish-speaking physician as well, and I think I've seen maybe 2 patients in English since I started residency, and not that we don't have patients who speak English, but I specifically very much wanted a panel with Spanish-speaking patients, and so it's been a huge home for me to be able to go to clinic where I see a bunch of patients who speak my first language and connect with them at that level. That's been incredibly amazing, and they are patients that come from many different countries, many of them undocumented and uninsured, and I just feel my med school was in El Paso, and which is at the border of Mexico and United States. So it was kind of a similar situation where there was a lot of undocumented and uninsured. So I just, like I said, I feel like I'm back at home and I'm able to connect with patients at such a deep cultural and personal level. And that's been absolutely amazing.
I really appreciate this program in allowing me to pursue some of my passions, including HIV primary care and child and immigrant health. Those were rotations that were kind of already set up for me and already designed for me. And then I was able to meet incredible mentors and great people that I can learn from, and really prepare me to be able to get extra training in those areas, and then set me up to apply for positions for next year where I can practice in those certain areas.